Hello, how are you? This is Kahari Baba again, and we are going to feature another African business in the DMV. And of course, it doesn't matter if you're African or Hispanic or white, black, whatever the case may be, and you're in the DMV. Please hit me up, call me if you're interested in doing some marketing for your business, reaching out to new viewers, potential new customers, new clients, potential new patients. Okay. Again, this is Harrison Uwozo and Hari Baba out here in Maryland, Glendale, Maryland to be exact. And who are we going to see today? So please remember to share this video worldwide. Let's continue to support one another. Africans support African businesses, African American businesses, Hispanic business, immigrant businesses. That's what we're all about. Let's support one another and let's see who we're coming to see today. All right. Oh, my number is 301-793-6430. You can also email me at tribex2000@gmail.com. All right, so hold on a second here. And today, we are here. Okay, and this is Suite 212. All right. All right, and here we are in the office. And this is Dr. Ilupeju's office. And this is his assistant, Mr. Jacob. How are you today?
Good, good. How are you?
Good, good, good. So we're here in the office, and we just want you to maybe show us around a little bit.
Yeah, happy to do that. So right here is just the general waiting area.
Okay.
You can just get a view about the size of the office, how many patients typically can be accommodated.
Okay. Okay.
All right, so typically when a patient arrives, they can be brought on back into one of the patient rooms.
Okay.
So typically they're brought into a room similar to this. You can see here, pretty basic setup. Here's where one of the physician assistants, like myself, would be at talking to the patient, asking about what brings them in, any issues that they have, any concerns. We also typically get vitals here, like your blood pressure. We also get height, weight, any other required vitals, and we can do a brief physical exam in the room as well, which is stocked with all the necessary supplies. Now typically after that, if a physical exam is needed, other procedures like say a pap smear, vaginal exams, pelvic exams, breast exams, anything related to either a regular annual visit, or if there's some kind of issue and we're trying to resolve that and want to do an exam, we bring them to another exam room.
Okay.
So that's typically
so pretty much everything's pretty much the gynecology right now. That's what
exactly. Yeah, this is really all gynecology. But we also do prenatal visits.
Okay.
Typically visits of that nature. Dr. Ilupeju also does do deliveries and OB procedures.
Oh, really?
As well.
Okay.
So that's something that obviously wouldn't be here in the office.
Exactly.
But done in a hospital setting. But the nice thing about that is you can also receive follow-up with him, the same surgeon who did your procedure here in an outpatient office. So there's no referrals. There's still continuity of care.
Okay.
So similarly, like I said, this room's a little stocked differently. So we've got a full exam table. We've also got all the necessary labs, tools, and procedures in order to do full pap exams. We can do STD screens.
Full pap exams, okay.
We can do regular pap smears, again, variety of tests, really anything that someone could want from an OB or GYN perspective.
So this office is in Glendale, and that's close to what areas? Because I know I have another doctor, Dr. Chitano Okaza. She's in Howard County out there in Clarksville area. She services that area. But down here, we're in PG County, am I correct?
Yeah, so that's PG County. So again, like you mentioned, your other clientele there is a little farther north. We're more in the southern sector of Maryland. So again, PG County and the surrounding counties around that area. We're not too far off from Annapolis for a lot of folks as well.
Annapolis
so again,
Road,
this is really, exactly. So this is really a great a sector for people to have care here. There's also the hospital system around here as well. But you're also only about 30-40 minutes from Baltimore, so it's really not too far off. So there's still pretty good accessibility here for you.
All right, sorry about that, guys. Little network connection there. But we were just talking about, okay, so what are some of the services, before I know we're about to see the doctor, what are some of the services, and tell us a little bit about yourself. What do you do here?
So like I said, I'm a physician assistant student. I'm one of the, typically one of the folks that will see the patient when they initially come in, get a good idea of what they're here for, what brings them in, or if they're following up for something. For instance, if they have test results they're requesting, or if they're following up from, say, a surgical procedure.
Oh, here we go. All right, sorry about that again, guys. Sorry for everybody being so patient. So we're here to see Dr. What's his name?
Ilupeju.
That's right.
Yeah, so again, a lot of the services you can look at also have to do with, say, annuals. A lot of woman exams can be done, but also if there are specific pathologies or issues, he's a great provider to come to. He can also do a lot of surgical consultations as well. He does perform a wide variety of surgeries within a hospital network, and with that he does things like hysterectomies, myomectomy.
All right, here we go, guys. Wow, sorry guys, everybody please be patient with us again, because this information is very important. We have a lot of women. The thing about it, I heard, unless you can confirm, when it comes to women's health, it's been challenging for women. Women are, so, and it's very important, and I love doing this because you guys are here in Bowie, PG County. It's very important for women in this area to know that you guys are here, what you guys do, so they can come here, come for their annuals, come for their checkups, do what they got to do, because here it is again. Wow, sorry everybody. The Wi-Fi in the office is not that great, but it is a doctor's office, and sometimes, like even in hospitals, it's tough. How are you doing, doctor?
Yeah, I'm fine.
Good. Nice to meet you.
Yeah, nice to meet you.
Can you introduce yourself to the people?
Yes, I'm Dr. Oluremi, Ilupeju, an OBGYN.
Awesome.
Yeah. Been in practice for about 30 years.
30 years?
Right here in Maryland.
Right here in Maryland? Awesome.
Yes, correctly.
So
yes.
Where did you start your career?
Well, I went to Howard University College of Medicine.
Okay.
Where I did my medical degree.
Okay.
Then I also went into OBGYN residency at Howard.
Okay.
So
Awesome.
that time when I finished, I've been in practice for about 30 years.
30 years.
Started in this one.
All right, guys. Hold on, let me apologize. Everyone, apologies. Please hang with us, stay with us. We're signed on to the Wi-Fi network now, so hopefully we have no more interruptions. But the devil is a liar. This is 2019. This is a new year. We have to help and save our women. Okay, and hold on one second here. So this is very important. Here we go. So sorry, you keep cutting.
All right, so like I was mentioning before, what's really nice about having what we call continuity of care. So you're able to see a provider, you see them for their regular visits,
right,
and you get regular screening, right? We always want to catch things before they become a problem. So coming in for your regular visits is important. And say we do catch a problem, or there's an issue that you have, some concern that you have, we can address it right then and there, and say if it needs surgical exploration or something more complicated, Dr. Ilupeju can also do that. There's no need to refer you out to yet another provider. In that case, you can actually still have him manage your care, say surgically, and then be able to follow up with him as usual, which is nice. A lot of the patients he's been seeing for decades, and that's really important, be able to follow up with your patients and have a good understanding of what their history is. Awesome.
All right, doctor. Well, sorry about that. We're now signed up to your network.
Okay, we can start all over again.
Yes, sir. So you can go ahead and tell us a little bit about yourself as you were.
Yes, my name is Dr. Oluremi Ilupeju, an OBGYN for the past 30 years.
30 years in the business.
That's
correct.
Awesome. Yes, that's correct.
Awesome.
So practicing in Maryland for about 30 years. Went to our University College of Medicine and did my residency in OBGYN, also in the hospital over there in Washington, D.C.
Awesome.
Correct.
What are some of your services here?
The service, as already mentioned by my assistant, is basically that we do annual wellness exams for women, pap smears, birth control, fertility testing, fertility treatment, fibroids, menopause, all those things that women need.
That's awesome.
Yes.
That's awesome. So what happens in this room right here? I think Dr. Jacob was just telling us. What do you guys usually do here in this room?
So again, this is a room that we have stocked with our lab supplies. There's a variety of screening tests that we can perform on patients, anything from STDs to regular pap smears, and this is typically where we process all of those samples as well.
Okay.
Yeah,
all right.
So also I do a lot of surgeries.
Surgeries. That's what Dr. Jacob was telling me about. You do a lot of surgeries.
Right.
That is great.
Yes, I've been delivering babies for about 25 years.
Oh, wow. That's a lot of babies. Wow.
I only stopped maybe a few years ago.
Okay.
To basically concentrate on taking care of fertility issues.
Fertility issues. So people who are having problems. So people who are having problems with fibroids, they should definitely call you.
That's my main strength, actually.
Okay, fibroids. Okay.
Yes, people that have fibroid issues that's causing them a lot of symptoms. bleeding, pain, fertility issues. So we help them to take care of those fibroids.
I'm glad you mentioned fibroid because I have a friend of somebody from my hometown. His sister died in last year in Nigeria. On the operating table, they were treating her for fibroids. So I guess you advise they come to you. If you're coming in from out of Nigeria or in the country or whatever the case may be, you've been doing this for 30 years, and when it comes to fibroids, you do a great procedure.
Fibroids is something that afflicts women of color. More than most other races. And this is basically tumors that grows in the uterus. And it can be taken out, to allow the woman to be free of those symptoms. Sometimes it can be in the way of fertility problems as well. I've been doing this surgery for about 30 years. It's a dangerous operation if it's not done by the right person in the proper environment. So people come to me from all over the world, actually, from Nigeria, from here, from Jamaica, and I develop a technique to remove all these tumors from the uterus. Oh wow! And help the woman to save their womb. Okay. And they can proceed to have a baby from that. Yes. And
you also mentioned fertility. So fertility, is that when a woman is trying to have a baby, if they're having complications, having difficulty, you also
yeah, fertility is basically a lack of being able to get pregnant. Right. And this is it's fairly common among women, and every woman wants to have children. And unfortunately, there are some situations where there could be some issues where the woman cannot have a child. So when they come to us, we do all these testings to find out the cause of the fertility. Right. And then once we find the root cause of the fertility, then we can address the issue and then treat it. Yes. Awesome,
awesome. Yeah, those are the two of the things I know that, over the past couple of years I hear the women complain about. The fibroid issues, like I said, I have people who I know personally have gone through that situation, and also the fertility. There are, women out there who are trying to have babies, especially our people, Africans. And so, what advice do you have? Because can you tell us exactly? Okay, can you tell us your address right now, where we are right now?
Yeah, the address right here. We're now in Glendale.
Glendale, okay.
Which is 12150 Annapolis Road, which are at the crossroads of Annapolis Road and 193. Okay. That's where we are in Suite 212.
Suite 212.
That's right.
Okay. And how do they get in? What number should they call? If they
the number to call is 301-439-4422.
301-439-4422.
That has been my number for at least almost 30 years.
So even when you had, because I know you were at a previous location to this, so it's still the same number.
Yes, I was in Laura in the beginning, and then we moved to Silver Spring. Right. And then, right now we're here, which is a very convenient location. Right. Many of the patients love this location. Right. It's a nice environment.
Plenty of parking, everything too.
Yeah, there's plenty of parking. Free parking. It's a nice environment. So that's where we are right now, taking care of business. Like I said earlier, the business that we do is taking care of women.
Taking care of women. I like that. The business we do is taking care of our, taking care of our women, because without them we wouldn't be here.
That's right.
I mean, if our mothers had complications, me and you, we would not be standing here today. Right. So that is why what you do is important. I was just telling them that I do have my sister-in-law, Dr. Chitana Okasi. She's in Howard County, in Clarksville. She's also a gynecologist doing great work out there. She has an office in Greenbelt. But the good thing about it is you are down here in the Bowie, Glendale area, and the people down, a little more south than her. So you may be closer to the people around in this area. What are some of the cities nearby, or what are some of the areas nearby that people come to you from?
People come to us from all over Maryland, actually. Okay. From Montgomery County, from first Prince George's County, where we are, from Baltimore County, from Baltimore, from Virginia.
From Virginia as well.
Yeah, from down south. People come to me from all over the place, and from outside of the country as well. From other states in the U.S., from outside of the country, from Nigeria.
That is awesome. So when they come from Nigeria, is it mostly for Africa? Is it mostly because of is fibroid the number one? What other services do they come for?
People come because they have many other issues like fertility issues.
Fertility, okay.
But fibroid is a very common problem. Okay. Like I said, in women of color. Okay. And like I said, that's my main strength.
Main strength, okay.
Which is basically to help them to remove those fibroids, so they can keep their uterus. Right. And proceed to
and also
from there.
And also the fertility, and also I guess the yearly checkup. What does the yearly checkup comprise
of?
Well,
yearly checkup is basically when the woman comes for the annual exams.
Okay.
Basically the focus of the yearly exam for a woman is the pap smear. The
pap smear, okay.
Which is basically checking the cervix for cancer of the cervix.
Okay.
To be sure that the woman does not develop that. We also do breast exams.
Breast exams, okay.
If a woman is in the right age, we send them for mammograms.
Mammograms, okay.
To check for the breast, making sure there's no lumps, no tumors, no cancers. We talk to them about many other issues.
Okay.
If a woman is past age of 50, we talk about menopause.
Menopause, okay.
If they have any issues or symptoms of menopause, like hot flashes and insomnia and so many other issues.
Okay. So let me ask you a question.
Yes.
So hot flashes and menopause, they're both one and the same thing. Sorry, I'm a novice.
No, insomnia is lack of sleep.
Okay, no, I mean hot flashes and menopause. Is that just...
Well, when a woman goes past the age, around 50, 51, that's when the ovaries begin to decline and the production of the hormones, the estrogen and progesterone from the ovaries goes down. So that's when the woman begins to feel the symptoms of menopause. And that comes in terms of hot flashes, which is the most common symptom that women begin to feel hot. Even when it's cold, the woman is feeling hot and kind of fanning herself. Lack of sleep, and so many other issues that come with that. So when they come to us, we do some tests to check the hormones, the hormonal levels, and then from there we can prescribe the treatment for them.
Okay, so people in this area definitely need to call you, especially African American, African women, people of color, but of course white women, Asian women, Hispanic, doesn't matter, and they should reach out to you. So if people come in, let's say that people coming from out of the country, people with their mothers and grandmothers, and they're concerned, well, how much, they don't have health insurance, and their mom that's just visiting or whatever. Do you have a program? Do you have a way where you can assist them? Let's say someone's mother is visiting, coming to take care, look after the kids, or they're in town for the holidays, and the son or daughter wants their mother, the grandmother, to get a checkup. What do you?
Well, basically, I've been around here for a long time, so I'm fairly well known in the African community. And I encourage some of my patients and friends, friends' wives, that when their family comes from Nigeria, if they have any issue locating the right person for them, the right physician for them, they can come to me. So I've become like a referral source. Okay. It doesn't have to be OBGYN issues. It could be any other issues. It could be cardiac. It could be orthopedic. Okay. I have a network of physicians.
Okay, so you have a network of physicians. So you can, no matter what happens, you can even refer them to somebody that you know, another doctor that you know.
Most of the time at no cost to me.
Okay.
It's like a voluntary service that I do for the community.
Exactly.
So that when the mother comes, they say, oh, my mother is having some cardiac issues.
Right.
Do you know any cardiologists?
Right.
Then I have a ready source of referrals and friends that I can send them to.
Okay.
And make sure that also I talk to those people so that the cost can be minimal. They can give them discounts. And if there's a gynecologic issue and they come to me and they don't have insurance, and the people from home or from around who have a low-income population, then we work with them in terms of discounts of.
So if there's
for our price,
exactly. So financially, so there's discounts, there's payment plans, there's just want to put it out there, because I know there's a lot of people, a lot of our people, we're bringing our mothers, we're bringing our grandmothers to help out with the kids and things like that. They're visiting, and you know how the medical. I'm not going to say that, I mean, back home sometimes, like I said, my own townsman sister, young woman, died on the operating table for fibroids. So these things should not be happening. So if anybody has the opportunity to come to America, specifically the DMV there in the Bowie, Glendale area, they should look you up, come through, at least call you, and at least, see you.
Yeah, the operation for fibroid, is quite... It could be dangerous. And most of the complications from removal of fibroids has to do, surgical removal has to do with bleeding. And if the facility or the physician is not prepared, like happens in Africa and Nigeria, then the person can easily run into trouble. So that's the issue. It's not that the doctor cannot remove the fibroids. After they remove it, then you have to be able to stop the bleeding from the uterus. And that is where sometimes the problem starts. But in America here, obviously, we have the facility. We have, the, of course, I have the technical know-how to do them, and then also the facility, blood transfusion, other ancillary services that we have here. That's what makes it a safe operation in this country.
And another thing, I'll have to mention this because it affected my mother, cervical cancer. So what do you, like, does a pap smear, is that what the pap smear is supposed to?
Yes, cancer of the cervix is alive and well, both in America and in the developing world. You know, the only way to prevent cancer of the cervix is to do pap smear. And what
about ovarian cancer?
Well, let me finish the
Okay, sorry about that. Go ahead.
Is the core of the wellness exam. You know, it's a screening method where we scrape some cells from the cervix, and then we test it for the development of cancer of the cervix. It takes a long time from a normal cells in the cervix to change to cancer. Okay. So once we detect any abnormality early, then we can quickly put a stop to it before it progresses to cancer of the cervix. That's good. Very, very important. That's
very important. So what you just said, basically, from my understanding, is that basically women, they have to come and see at least once or twice a year, see their gynecologist, do the pap smear, because if there's any abnormality, you can catch it in time and save lives. But if you don't go to see your gynecologist, if you don't go to see your doctor, there's a risk that something could be there, and God forbid,
Yeah, it doesn't have to be twice a year. It could just be once a year.
Once a year, okay.
Yeah, when you come to see us once a year, the wellness exam doesn't mean we have to do pap smear every year.
Right.
Actually, the pap smear has gone from once a year to at least once every 1 to 3 years.
Okay.
But by you coming to me every year, we can talk about other issues that impact upon your life as a woman. Whether it has to do with menopause, like I said earlier, we can do sonogram to check for fibroid tumors. We can do sonogram to check for ovarian cysts that can become ovarian cancer down the road. We check your blood for different things. We check your hormones. We check you for STDs. So there are many things that we do as gynecologists that a woman needs, and on a yearly basis, by coming, and you can tell me what your problems are, and then I can address them.
Yeah, so I'm sorry, I apologize for cutting you off early, but I just had to, I was jumping the gun because my mother actually passed away from ovarian cancer in 1996. She was diagnosed in 95 or so. They told her that she had fibroids, and they were treating her for fibroids while she had ovarian cancer. This has happened to my mom. I think I have another friend in Maryland that has happened to his mom as well. So ovarian cancer, how is it detected? How the early signs? What?
Well, ovarian cancer is one of those cancers that are very dangerous and difficult to diagnose. The only way that a woman can really corner the issue of ovarian cancer is to have your regular checkup with physicians. By us examining you, we can feel if there's any tumor growing in your ovary. And if I cannot feel it properly, I can send you for sonogram or ultrasound.
Sonogram, ultrasound.
Yeah, which can detect the early beginnings of an ovarian cyst from the ovary, because this is basically ovarian cancer is a cyst from the ovary.
A cyst from the ovary.
Yeah, the ovaries grow different type of cysts. And the worst case of cyst that an ovary can grow is ovarian cancer. And unfortunately, by the time a woman discovers ovarian cancer, it has become.
Well, my mother got stage 4. So what happened?
Stage 4. Yeah. And the lady's the person is almost ready.
But the thing hurt me the most is that they misdiagnosed her, and stomach pains or whatever. Stomach was swelling, which I believe is one of the signs of ovarian cancer. Now we found out. And then my uncle, thank God for him, he said he went and got a different what do they call it? Perspective. He went to see another doctor in Enugu, and then they figured out what it was, and then we flew her here. But by that time there was no, hey, it's just my stomach, it's just this, it's just that. They're giving her all kinds of silly medications. By the time she got here,
Harry,
it was too late.
I'm so sorry to hear that. And unfortunately, you and I know the limitations of what we have, where we come from, the limitation of infrastructure, limitations of diagnosis, limitation of proper training of our physicians. But it shouldn't really be a difficult thing when a woman presents to somebody and says, I'm having stomach ache.
Right.
You can send that person for CAT scan, ultrasound, MRI, But unfortunately, like I said, if a doctor wasn't, is not in tune with the patient,
right?
A misdiagnosis can
be so painful. Yeah,
it's a very painful thing. I really sympathize with you on that. But basically, it's just a matter of coming to us for your annual checkups. That's what we only ask.
I hope everybody here is listening. Please share this video. Yes. This is very important. Yes. Too many of our mothers and sisters and nieces and in-laws are dying. They shouldn't have to die. All they have to do is come for an annual checkup. Now, how much is an annual checkup?
Anyway, if we're going to run some tests, if you don't have insurance, about $200.
$200 if you don't have insurance.
Yeah, out of that money, we also probably pay the lab for your pap smear. So it's not just all that money for us.
So that's $200 a year to save your life.
That's right.
To make sure you do not have cancer of the ovaries or cervix or any abnormalities in your body. $200, which is divided up to, what's that, less than $12 a month or something? So I don't know.
Yes.
So,
like I said, I've been an OBGYN for about 30 years, and I pride myself for looking over the health of our women.
Yes, sir.
Especially women of color, women of African origin, the underserved, underrepresented people in our community. I've honed my skills over the years, and I'm continuing to do that until I retire. So once again, what we ask of you is to call us, make an appointment, and no matter what ails you as a woman, whether it's my field or any other field, if I cannot take care of it, I will refer you to the right person that will take care of you. If you're pregnant and there's some complications, I can also find the right person for you. If you're having any other medical issues or your family members and you don't know where to turn, you can also come to me and I can always find somebody for you to take care of that. Okay, so
before we go, one more time, your name and your address and your phone number.
Once again, my name is Dr. Oluremi Ilupeju, originally from Nigeria. I've been in the U.S. for a little while, went to school at Howard. I did my master's degree at Howard University in Washington, D.C. Then I went on to medical school. And then after medical school, I went into residency program in OBGYN. And I've been practicing for about 30 years now, right here in the whole of Maryland, D.C. and Virginia. So I welcome you to come to my practice. Our number, once again, is 301-439-4422. All you have to do is call us and we'll be ready to take care of you.
Well, thank you, sir. Thank you for that. I'm going to share this video. Hope everybody that's watching, please share this video. It's very important. Like, if my mother had somebody like you when she was alive, she probably would still be alive. So health is very important. You can have the houses, you can have the cars, you can have the money, you can have the properties, you can have the jewelry, you can have all of these things. But at the end of the day, if you don't have your health, what is it worth? Look at even the guy that owns Apple. Where is he now? So at the end of the day, my people, we have to see our doctor. I just saw my doctor last week. So at least once a year, if you have health insurance, I'm sure it covers all the health. Yep. But if you don't have health, we're talking about $200 for a whole year. Once a year, $200 coming through your pap smears, coming through what you have abnormalities and any issues you have. All women in the area. I don't care if you're African, white, black, blue, purple. Come and see, the Bowie area, wherever you are. Please, call Dr. Ilupeju. Please.
And to close, just like Harry said, your health is the most important asset that you have. Without your health, you have nothing. And like I always tell people who are willing to listen to me, the only reason why you're able to get up and go around to do whatever business you're doing is because your body is cooperating with you. Once your body decides not to cooperate with you, then everything else will be over. So please take care of your health. Once again, if you don't know where to go, if it's a man or a woman of African origin or any otherwise, and you feel like you don't know where to turn to for yourself or for your family members, if it's something I cannot do, believe me, I'll find a ready resource for you for referrals. If it's a woman, please come to me. Believe me, I'll take care of you. I've been doing it for about 30 years. So good luck to you.
Thank you, sir. God bless you, Doc.
God bless you too.
All right. Thank you.